Welcome back and thank you for tuning in to day 3 of PsychedelX 2025. Up next, we have our second keynote speaker, Gina Giorgio. Gina Giorgio is a dedicated advocate for mental health, drug policy reform, and psychedelic therapy and research, currently serving as the Director of Strategy and Development at Students for Sensible Drug Policy, also known as SSDP. In this role, she helps lead federal and state efforts in psychedelic and cannabis policy reform, promotes evidence-based drug education, and fosters career-building opportunities for young professionals in advocacy and policy work. Gina is the founder of the North Carolina Psychedelic Policy Coalition, a coalition dedicated to expanding access to psychedelic-assisted therapy and research for veterans and populations disproportionately impacted by trauma. She is also a board member at the Pearl Institute, one of the few MDMA-assisted therapy expanded access sites, and the National Psychedelics Association, a professional association serving the licensees of state-regulated psychedelic service programs. She is a member of the Veterans Mental Health Leadership Coalition. She earned a master's in communication from Wake Forest University, where she conducted the first content analysis of psychedelic portrayals in major US newspapers, highlighting the interplay between media narratives, public perception, and policy efforts. Her presentation today is titled "Psychedelic Law Starts Here: How You Can Impact Every Level of Government." Gina, please take it away. Yeah, we can see the full screen.
Perfect.
Thanks, Gina.
Amazing. Thank you, guys. It's a pleasure to be here. This is my first IPN conference, but I really got my start in psychedelics through psychedelic career mentorship. And so I'd love to go a little bit into background of who I am and how I really got to where we are today. And so my name is Gina, as mentioned, Director of Strategy and Development at Students for Sensible Drug Policy, founder of the North Carolina Psychedelic Policy Coalition. Some of our members are on the screen here. But I mean, really, I actually joined getting into the psychedelic career field through SSDP, and I actually wasn't even a student at the time. So I had just graduated. It was a year after, it was 2020 when I joined SSDP. And prior to that, I was really interested in mental health and in the therapy field. So I pursued a bachelor's in psychology. I obtained that, but I had actually learned about psychedelics through a documentary called Hamilton's Pharmacopoeia. And that really opened my eyes to potential avenues of medicine and mental health care that I wasn't learning about in my clinical psychology program. And so just from watching people's stories and outcomes from that documentary and like the profound transformation that they were reporting on was actually what really inspired me to pursue working in psychedelics full time. And at that time, I was 21 years old and I didn't really have much experience in the field. And so I really looked to organizations like SSDP and MAPS and IPN to provide some foundation into what are these substances? How are they being researched now? What are the career opportunities? How can we really implement these in a political way? And so I think I'm here to tell you that I don't have a formal law background or a political science degree. I have the bachelor's in psychology and a master's in communications, and I really got my start through grassroots political organizing. And at that time, I was 24 years old when I began advocating for psychedelic policy reform, mostly on the state level, but since then it's expanded to state and federal. But that this is a field that we are all co-creating together. And I think that that's what's so beautiful about this space and spaces like this that are creating young leaders to really pave the way. And so I'm excited to kind of give you an overview of what we're working on at SSDP, what is happening on campus, city, state, federal, international level. And really the point of this is provide you opportunities and insights into how you can best get involved. Because I think that when I was younger and I was entering this field, that was something that I was most interested in, which is I'm seeing all of these updates, but it's really unclear to me how can I actually make an impact myself. And so that kind of brings us to SSDP. And so I joined SSDP as a member in 2020. And then I began as a part-time intern in 2021. At the time, we had something called the Psychedelic Pipeline, which was a psychedelic career mentorship program. And that really was created by a few people, but Wes Hale, Dr. Bill Marie Forgata Narlock, and various other volunteers who saw a need for really properly training and networking the next generation of psychedelic leaders and professionals. And so I was honored to be able to intern for that program in 2021, which led me to be program director the next year. And then I started full time with SSDP last year as director of strategy and development. So it's been a journey, and SSDP predates me by a lot. So it actually was started in 1998, and SSDP is the largest national youth-led network dedicated to ending the war on drugs. And so we are led by staff, part-time, full-time, as well as various interns and a board of directors that is elected by from our student and youth members. And so, really, our goal is to mobilize and empower young people to engage in the political process from all levels and all ideological and political orientations, and see how can we have more honest conversations about drugs and drug policy. And I'm sure that this is a more open and receptive group about drug policy, and I think that it's really changing with the generations, but there are still so many outdated policies that we'll get into and outdated stigma. And so we are 501(c)(3), 501(c)(4), so we engage in both education and political organizing. And SSDP, I work for US SSDP, but there's actually international branches of SSDP for any of you that are in other countries. So there's SSDP Canada, Ireland, Africa, Australia, New Zealand, and there's so much more. So happy to connect you to wherever you need to be. But I'll mostly be focusing on our US efforts. But we have around over 100 chapters across the US, as well as thousands of alumni. And so from this photo here, we were at Psychedelic Science this past week. I think mentally I'm still at Psychedelic Science, as I'm sure some of you are. But here we're joined by some of our current members and board staff and alumni. And so, for example, the MAPS co-interim executive directors, Izzy Ali is here, and Betty Aldworth isn't pictured, but Betty Aldworth was executive director of SSDP for about 8 years, and Izzy used to serve on our board. And so the psychedelic space has actually really deep roots through SSDP. And so, just a little overview of our work and what we do. I touched on this a bit, but creating spaces for young people to have conversations about drugs, particularly on college campuses. We engage in training and often provide scholarships for people to go to conferences. So, Psych Science was one of them, but we love for people to be able to kind of have that hands-on and in-person networking and experience. So, we always aim to provide students with free conference passes, free lodging, and things like that. And we'd engage in a lot of grassroots organizing and political efforts, not just for psychedelics, but cannabis legalization, decriminalization, harm reduction, overdose prevention, and things like that. And we actually have special consultative status with the United Nations. And so I'll talk more about this later on, but we actually sent about 10 of our students to the UN Commission on Narcotic Drugs in Vienna, Austria. And so looking to get more involved on that international front as well. But really, we come down to a few different pillars, which I feel like IPN also embraces, that movement building, creating the next generation of leaders, and engaging in community organizing, policy change, as I mentioned. And I'll get more into what that looks like on our psychedelic front and the training and education as well. So there's so much to go into when it comes to psychedelic law that I definitely can't cover all of it, but I really want to tackle and address what I feel like is the most relevant to this group. But I was looking and I think about over the past few years, 38 states have introduced 220 psychedelic bills, and not all of those have passed, of course. Most bills, just in general, don't pass. There's hundreds of bills that are introduced every session. But I think it would be helpful to just give an overview, city, state, and federal, like what does this look like right now? Because it's really changing every single day and it can be hard to keep up with. But if you are keeping up, you're probably using the website Psychedelic Alpha, which I've cited here, but they have a great tracker that's looking at legalization, decriminalization, and things like that, and dividing it by really all of these city and state updates. And so there's different ways that we're kind of, which I'll go on to, but how we're kind of organizing this, and we're seeing trends over time that I think might be helpful for us to dive into a little bit. But you can see that quite a lot of these states have active legislation. I am in North Carolina, and we currently have a task force bill on the Senate side, which is active. And Texas, for example, is leading. They just passed a $50 million ibogaine research bill for FDA trials. And you might have also saw that New Mexico is the first legislature to pass medical regulated access for psilocybin, which is super exciting. But just to give you a bit of a lay of the land, and I'll dive more into kind of what are these psychedelic policy categories. And so I'm not sure if any of you were at Psychedelic Science, but if you were, Sam Chapman gave a really good talk, and this is coming from his psychedelic policy report, which I'm happy to follow up with any materials. But Sam Chapman, who's also an SSDP alum, he was a campaign organizer for Measure 109 in Oregon. But he, over the past few months, has been engaging in this really extensive report of the different psychedelic policy categories and updates and mapping out what works, what doesn't, what are the trends. And this is just a graphic from that, which I thought was really helpful to see in terms of really pushing progress forward. So I'm actually going to dive into a little bit what these are and like why they're really relevant. But I mentioned North Carolina has a study committee proposed right now. So we're seeing that study committees have are on the rise, but also are most likely to be enacted. And I would say that that's probably because they're not creating any legal access and because it's a lower just financial lift. And so a study committee or a task force bill would basically create a group of experts and legislators to see what the potential pathways are for research, legalization, or decriminalization in their particular state. And so places like Maryland has a psychedelic medicine task force, Vermont, Wisconsin, Alaska had one. There's various states. And so I think that, especially I live in a more conservative state when it comes to drug policy, that we feel like this is kind of a really safer lift for people. So it's really just, can we request more information on psychedelics and how this might work in our state? And so that'll move us to automatic rescheduling. And so I'm sure you're all keeping up with the updates on FDA approval for MDMA for PTSD. And so, for instance, if and when MDMA, for example, gets approval from the FDA, it can be rescheduled because it's Schedule 1 right now. But there are certain states that don't have what we call automatic rescheduling. So you would need to create a bill that would say, okay, when the federal government reschedules MDMA, the state will follow suit. And so there's a few states right now that are looking into automatic rescheduling, and it kind of just streamlines the process by being able to put that into law. And I probably don't need to go into too much about what clinical trials are, but those ones are also very popular. But um, clinical trial bills are tricky because they can be costly. but on average, you're also only seeing about 10 to 20 patients in a clinical trial. So it's kind of an expensive way to assess efficacy, and it can just be a longer, drawn out process. State-based pilot programs are becoming a bit more popular, and Connecticut and Yale University a few weeks ago actually just launched their state-based pilot program. But that's kind of in between um, regulated access and clinical trials. So you're not creating a legal system, but it's going further beyond clinical trials to collect real-world data into psychedelic assisted therapy. I'm sure you're familiar with decriminalization. There's quite a lot because these are usually falling under city level. And so we're seeing that there are really high levels of introduction of decriminalization bills, but really low implementation of them. And so that's really, I would say it's always a hot topic. And you're probably familiar with, so for example, Oregon passed Measure 109, which created their regulated psilocybin program, but they also created Measure 110, which would decriminalize most drugs. And so there's various issues around how that was implemented, and they actually drew that back to work on recriminalizing substances, which I'll go on to further. But um, it's it's tricky because, of course, a lot of people use psychedelics in various contexts and may not always need to use them in a medical context, of course. But um, decriminalization at times just legally can be a harder sell. And I think that really just begs into question, how are we educating people about decriminalization and how that can really work in our system? Um, and so medical access, I kind of mentioned New Mexico just passed a medical access bill to access psilocybin in a state regulated way. They're the first legislature actually to pass medical access. So prior to that, Oregon and Colorado passed their regulated models through ballot measures. And adult use. So that's Oregon and Colorado have their adult use model. So you can go to service centers and access, for example, psilocybin. In Oregon, you don't have to have a certain condition to access psilocybin like you do for some other programs. Implementation just is more for states that have actually already legalized psychedelics. So implementation bills are just creating clarifications to bills that were already introduced, like in Oregon and Colorado, and changing rules and regulations. And then this one kind of surprised me that there are recriminalization bills. So Florida actually created and passed a bill this year that would criminalize the possession of psilocybin spores. So I'm not sure if we'll see that on a larger scale, but you're probably familiar that it's legal to possess psilocybin spores. It's just illegal once you actually grow them. So maybe a loophole. But this is just, yeah, sort of an overview of the categories. And then I'm keeping it to the basics, but just to make sure we're all sort of on the same page here, this is our system for how we schedule substances through the Controlled Substances Act. And so I'm not going to go through all of these, but I just want to like kind of outline and put into perspective that, we're seeing all of these clinical trial policy advancements, but pretty much all of these substances are still Schedule 1. So that includes cannabis, psilocybin, MDMA, DMT, LSD, which Schedule 1 is the most restrictive drug scheduling category, and that indicates that legally there's no currently accepted medical use and that there's a high potential for abuse. So we could debate that for a really long time, but we're not going to. But this, dates back to different social political issues at the time, the Controlled Substances Act in the 70s, and essentially how drugs were just placed into Schedule 1 very easily, but how we've seen how difficult it is to actually get them lowered in their scheduling status. But it is interesting to note that, for example, cocaine is actually Schedule 2, so it has some approved medical usage. And then I just wanted to mention that ketamine, which is an anesthetic and a psychedelic, is Schedule 3. It's approved medical use as an anesthetic, and it can also be used off-label for depression. But there are different types of ketamine as well. And so SSDP also currently has a drug scheduling case against the DEA. So we have the first formal in-person psychedelic drug scheduling case with psychedelic substances DOI and DOC, which aren't on here. They're actually unscheduled substances. But we have the first formal scheduling case since MDMA was scheduled in 1986. I'll dive more into that, but also just want to relay that there are still current scheduling issues around psychedelics and cannabis, and this has just been an ongoing issue. So quickly, as I mentioned, you're familiar, I'm sure, with MDMA assisted therapy for PTSD, which completed phase 3 clinical trials last year, pending FDA review. Um, there wasn't a rejection for MDMA, but there was a request for more information, and they suggested completing another phase 3 clinical trial. And so that's a psychedelic that has made it furthest, and I'm sure you know that Lycos and MAPS are the ones that have been pushing for FDA approval of MDMA for decades, honestly. And so, not too far behind is psilocybin, which is in phase 2 and 3 trials, mostly for depression and substance use disorder. And that's sort of a theme that we're seeing with some of these other substances that are catching up as well, mostly looking at depression, substance use disorder. I mean, ibogaine has been talked about more and more frequently. And so, if you're not familiar, ibogaine is a shrub from Africa, and it has been shown to be a really strong substance for eradicating opioid dependence, even just from one usage. But it does come with potential cardiac risks. And so, there's issues of being able to monitor people and doing ibogaine in a more controlled setting. But there are people that are looking at phase 1 and 2 trials, same with 5-MeO DMT, DMT, and LSD as well. I don't have ketamine on here, but ketamine is also in various clinical trial phases. So, what I'm about to get into, which is that there's a lot of updates, there's a lot of ways to get involved. And as young people, as I mentioned, you're actively shaping this field. And so I want you to shoot your psychedelic shot, figuratively or literally. I don't really know what that means, but that's kind of how I approach my work, which is that there's so much opportunity and that I want you to be able to really put yourselves out there. And I think that this is a really exciting time, not just for mental health care, but psychedelics as it pertains to religion, spirituality, physical pain, all of that. And so, whether you're interested in a psychedelic career or not, I think there's a lot of exciting ways to get involved. Even if you're not politically minded, I'm going to talk about some ways that I think you can still really make a difference. And so this is going to dive more into how you can engage on a few different levels. So I'm going to talk about campus level, city level, state, federal, and international a little bit, and talk some about what we do at SSDP and then other ways that I think you all might be interested in getting more involved in psychedelic reform space. And so you may be part of IPN already. I think that's an awesome start. Having an SSDP chapter is an awesome start as well. And so I'm actually not super familiar with campus reform for psychedelics. I'm curious if any of you are. I have not seen that specifically, like changing campus laws related to psychedelic possession, but that would be interesting. What I have seen more of is pushing for, of course, psychedelic research at university levels. So I would say, I mean, you all have connections to your researchers and professors at universities, but even having conversations with them about psychedelics. I conducted my master's thesis. I got a master's in communications, and I did a content analysis on how psychedelics are portrayed in the news. And it was a big learning curve actually talking to my professors about this topic because it wasn't something that I had ever heard about before. And so it was one thing to embark on this as a long thesis research project, but to even be able to catch people up to speed a little bit on the conversation. And so I think it's helpful to even just make your professors aware that this is going on, even though it might seem like it's prevalent to us. It's really not to most people. It's not on their radar. I love this one, hosting educational events, film screenings, panel discussions. I'm sure a lot of you are doing this already, but I think that that's just a great way to bring other people into the conversation. Um, this is one thing that we do a lot, and it isn't necessarily psychedelic specific, but a lot of our SSDP students collaborate with their health services on campus to provide information on harm reduction, integration support, safe spaces. I have a student here or a photo here of a student from SSDP. This was featured in a newspaper, but one of the co-president of the University of Washington SSDP chapter helped to get drug testing strips and Narcan at their health center on campus. And that's something that we've seen a lot actually, as well as a rising interest in having sort of safe spaces or wellness spaces, whether that's psychedelic specific or not. City level, I personally don't haven't engaged as much in city level reform for psychedelics, but it's super popular. And I've seen recently Tacoma, Washington, for example, decriminalized or deprioritized psychedelics this year. And especially we're seeing in a lot of like West Coast, northeastern cities have decriminalized psychedelics. But there's a bunch of ways to get involved, city level as well. But talking to your city council members and just being you might be the first person that they've ever heard about this from. And so it can be kind of daunting and intimidating, but it is I think that you might feel like you might not have a lot of say in the political process, but I think that you do if you're especially the first person that they're hearing the benefits of psychedelics for PTSD, for example, from supporting local campaigns for decriminalization. Um, there was the Massachusetts legalization decriminalization campaign last year. I know a lot of people got involved with that one, and I ended up working on that campaign for the last month. But there's also a lot of decriminalization nature chapters or decrim nature. I know the Virginia one is fairly active, but a lot of these decrim nature chapters have successfully decriminalized, for example, different psychedelic possessions in their cities. I mentioned I love doing the community events, so this is one that we did in January of this year. I collaborate a lot with our psychedelic societies, specifically in North Carolina where I live. So we've got a few of them, Charlotte, Psychedelic Society, Asheville, and the Triangle. And so this was us this year in Chapel Hill Public Library with the Triangle Psychedelic Society. And this was me and a former North Carolina rep, current North Carolina rep, and then a member Logan Davidson, who participates in psychedelic policy reform in Texas. And we were updating the community on what's happening on the legislative front. And I think that that's just a really helpful way to bridge the conversation and provide some transparency into the psychedelic political process. And I just personally really try to engage the community as much as I can in this process. And I think that their buy-in and weigh-in is extremely valuable. I mentioned building relationships with city council members, um, joining harm reduction organizations. So I used to volunteer for a syringe exchange site in Winston-Salem, North Carolina. You might have other harm reduction or education groups in your city as well, but it's awesome to just have that, in person on the ground experience as well. And that ties us into state opportunities. And so I mentioned I generally engage more on the state level, but if you first point of contact always is contact your state legislators about psychedelics, whether there's a current bill or I hear all the time about legislators introducing psychedelic bills because one of their constituents came to them and talked about how much of a profound benefit that they had from it. So I wouldn't underestimate utilizing your personal story and being able to influence psychedelic legislation. Testifying at hearings, these are not always, but sometimes public. And if you're not able to testify in person, be able to write and submit a letter. Um, the next one is one of my favorite ones, but building statewide coalitions. So I mentioned we have the North Carolina Psychedelic Policy Coalition, which is a coalition of mental health professionals, clinicians, veterans, patients, researchers across the board. And I think that it's really helpful for having a unifying voice to push this issue. It shows cohesion, it shows broader scale support. Um, and as I mentioned, I was about 24 years old and I didn't have a political background while I was building our statewide coalition. So I don't have time to get into all the details of what I recommend for that. Always happy to talk offline about best ways to go about that. But some lower time commitment ways of getting involved are also to host or attend advocacy days at your state capital. So a couple weeks ago, I co-hosted a psychedelic medicine lobby day in North Carolina. We had about 30 participants and 25 legislative meetings and had a press conference. And a few months ago, I also went to the Texas State Capitol, the Texas Cannabis Collective, and one of our SSDP members, Jeanette McKenzie, as well as many others, helped to put this on. You might have been keeping up with in Texas, there was a hemp ban proposed. And it passed through their House, it passed through their Senate, and just a few days ago, their governor actually vetoed their hemp ban in Texas, which was really exciting. Um, but this is another like young person and student-led example of a really effective lobbying effort that's happening out in Texas. So just want to give a shout out to them. Um, and of course, if you're not, super politically minded, but always recommend just engaging in public education and education campaigns on that front. Oh, there we go. Okay. Quickly, I'll go over just some federal psychedelic updates, but there's actually a federal psychedelic caucus, which is bipartisan. So it was created by Congressman Correa, Congressman Bergman. And so this is me and our SSDP executive director. We were at a bipartisan psychedelic medicine federal roundtable in January of this year. And so the Psychedelic Caucus, it's called the PATH Caucus, Psychedelics Advancing Therapies, is semi-regularly hosting congressional briefings, and those are open for people to attend and participate in. So always happy to, plug you guys into that. But that ties into SSDP and other groups are regularly attending congressional briefings, lobby days, fly-ins, as well as submitting public comment. So for our case against the DEA, it was an option for people to submit public comment, as well as the PATH Caucus actually was seeking public comment on ways of advancing psychedelic therapy and research. So there always are those opportunities. They can just sometimes be hard to find, but there's always ways we can plug you in. I mentioned this before, but I will never, I will always continually advocate for if you're comfortable sharing your personal story. I think that in my experience lobbying with state and federal legislators, that they always respond more to stories of personal transformation than they do to the research, actually, as exciting as the research is. And of course, intern or volunteer with a federal focused psychedelic nonprofit or policy group is just a great way to kind of get your foot in the door and learn more about what's going on. But I mentioned this before, but we currently have a drug scheduling case against the DEA, and that's for psychedelic compounds DOI and DOC. And those were first synthesized by Sasha Shulgin. So you might be familiar with Sasha and Anne Shulgin, but they both popularized the use of MDMA in conjunction with therapy decades ago. And Sasha Shulgin has also synthesized over 150 compounds. So very major and very profound for the field, but two of his compounds, DOI and DOC, are unscheduled psychedelic research chemicals, and they have been used in preclinical research to understand how serotonin works in the brain and body. And they've been cited in about 1,000 research papers at this point, but they're mostly used in animal models. They last about 24 to 36 hours, the effects in humans. So it's not something that people are taking, but this is a helpful kind of precursor to understanding how psychedelics are working in humans. And so they are unscheduled. And a couple of years ago, the DEA motioned or suggested to move them to Schedule 1 of the Controlled Substances Act, the most restrictive category. And so that's something that we've been pushing back on for the past few years. And we're always sending out updates about that, but that's just a very relevant example of how psychedelic scheduling is still happening. And I will go into quickly a little bit of our international work, but I mentioned earlier this year, we actually sent about 10 of our students to the UN Commission on Narcotic Drugs in Vienna, Austria. And so we have UN special consultative status. And so we sometimes have these opportunities to participate in UN events internationally and in the US. And so one of our, Elijah Ullman, shout out to him, he has been part of SSDP since he was in high school, but he's been really driving our DOI and DOC case against the DEA. And he also was able to share a statement to the UN about the importance of assessing research harm. So, one of our main considerations in our DEA case is that scheduling DOI and DOC would, of course, cause harm to research, which is not one of the factors that the DEA typically considers in their drug scheduling. They use something called the eight-factor analysis, which assesses abuse, effects on public health and things like that. And so the administrative law judge through the DEA actually motioned to consider the harm to research during our hearing at the DEA last year. And this is something that Elijah had written a statement about and shared with the UN, which was really exciting. Um, but there are, of course, ways we're happy to plug you into UN opportunities, but there's also the UN Major Group for Children and Youth, and you're able to send in an application to join that as an individual, and it's really a way to bridge relationships and what's happening between the UN and youth. There's always various advocacy days to participate in, submitting statements or side events through the UN, as I had mentioned. But I mean, tracking international or national scheduling decisions is really helpful. That's really how we knew that DOI and DOC were being suggested to be placed into Schedule 1. And so we have some of our members who read the Federal Register, and that's how they know. But definitely, those things aren't always publicized. So I recommend keeping up to date on that. And so, just as I had mentioned before, but there's so many that I can't get into all of them, psychedelic policy updates, but there's also always so much more happening more broadly with the war on drugs. And so some ways that we continue to engage are, I mentioned hosting overdose prevention trainings. We drove 24% of the 43,000 public comments on rescheduling marijuana. So we've been working a lot on marijuana rescheduling and decriminalization. There are currently, I believe it's 11 active cannabis bills, and we're part of the largest bipartisan cannabis coalition. And so we're pretty regularly going to Congress to speak about cannabis reform as well as harm reduction policy. Um, we advocate for statewide syringe services, as well as we have a drug education program, which I'm going to dive more into later on. So this is just, a little bit of a summary of what I mentioned. This is also a photo of all of us at our Cannabis Week of Unity. So we go every year to DC as part of the largest cannabis coalition that's working to deschedule cannabis, but also provide record expungement for those that have cannabis charges on their records. And so that's another, big consideration with drug scheduling and the war on drugs is that cannabis is legal in so many states, but people are still being prosecuted for cannabis possession. And so that's something that we're still continually pushing back on. So, as I mentioned, some ways of getting involved, but also I would say you don't need to have a law degree or any formal education to get involved and make a difference, but it is an avenue that some people do pursue. So, as I mentioned, pursuing a law degree for a more formal career in psychedelics is a possibility, but I just wanted to provide you all with a quick overview of careers and opportunities for getting involved. I did mention some of these, such as campaign director, coalition organizer. I mentioned task forces, but being a member of those task forces, um, in states where psychedelics are legal, working in on the regulatory side, like in Colorado and Oregon, is an option. Being a researcher, um, these are a couple of the ways I see more people get involved, but being a lobbyist or also interning or being a staff member in a legislative office, I think is kind of an understated way of getting involved in this type of work really directly. And so I wouldn't be doing my job well if I didn't tell you how you can more officially get involved and connected and tapped into what we're doing. And so I don't just want to tell you about what we're doing, but I want to make sure that you can actually get involved. And so there's a few ways of doing that, which are starting a campus chapter if you're a current student. If you're not a current student, you can start a community chapter. So, for example, our Pittsburgh community chapter is really popular. And so, yeah, you don't have to be a student to join SSDP, but so it's pretty open and inclusive. And if you don't want to start a chapter, you can also be an individual ambassador. And so there's more information on this on our website under the chapters page. But probably the easiest way is we created an app, and this came out about a month ago. So it's free to download. So you can download our app, and it kind of has like all the links and information for really getting involved. And similarly, on our app, we actually launched our Hope harm reduction program. So you can do this free 1 hour harm reduction course. And once you finish that, we'll send you actually a free harm reduction kit to your house in the mail. And that includes fentanyl test strips, naloxone, gloves, CPR mask, and some SSDP stickers. So this is actually aside from being a chapter member, being an ambassador, this is, I think, one of our best ways of really engaging with SSDP. And I would assume that you all have a specific interest in psychedelics. And so we actually have a psychedelics committee, which launched recently. So shout out to Jeannie and Taylor that are co-organizing our psychedelics committee. And so this is a lot of QR codes. I'm happy to share this with you all after, but these all go to forms to join our committees. So I mentioned psychedelics. We have a drug education committee that's developing our peer-based drug education program. We have our science policy committee. That's really been pushing our DOI and DOC drug scheduling work and our research harm work, if that's of interest. Harm reduction committee, of course, focuses on overdose prevention trainings and things like that. Law and Justice Committee is newer. I don't have as much info on that, but I would also assume that that's going to relate to some of our more record and expungement work. And if you are an alumni, we have an alumni committee. And so we have so many current SSD peers, but also so many past SSD peers, and we want to continue to engage you all in the process. So feel free to scan and get involved. Okay. I'm doing pretty well on time. So that leaves us with about 15 minutes of Q&A if there are questions, but I really wanted to open up that space to you all if you have anything specifically right now that would be helpful for me to answer. But yeah. I'm not sure if I can see questions from my end, but if there are any, I'm ready. Oh, yes, I see someone. I think Daryl. Oh, I think I can.
Hey,
There we go. Hey,
thank you very much. Can you hear me now?
I can hear you. Yes.
Okay. I mean, I just come to help really because I've been working. I actually went to the first SSDP talk ever in about 2008 in England.
Wow.
And we also had David Nutt come and speak.
Hmm.
And at that time, I was representing an LSD chemist, a United States citizen, Casey William Hardison. And we tried to appeal his 20-year conviction in the United Kingdom. And we came up with some very important work. And I'm still trying to kind of spread it around because I think whilst it is a critique of the current narrative that we're in, it does help. And what I'm interested in introducing would be this idea of using person-centered language. And I always refer to putting a human being into a sentence when we talk about drugs, because ultimately we're not really regulating objects, we're regulating consciousness, we're regulating ourselves. That's the biological reality of it. And it's interesting that the law is consistent with that, in that there are no illegal drugs, and cannabis cannot be legal in law because using legalese, which is the real power language that we have, it's a supercharged language, is that the only thing that can be illegal or legal is a human action or a human emission, but not the object. It's just a figure of speech that we're using. For example, when we talk about a war on drugs, I mean, it implies some kind of neutrality about an objective endeavor, but really it's always a war on people, and human-centered language would say that. When it comes to the legality of substances, they don't have a legality. It's just a figure of speech. It's us that act illegally if we don't have a license or a prescription or an exemption or an authorization to do what we're doing. And that is our target area. That's the SSDP target area, is sensible, proportionate regulation of people, of their experiences, of their access, not of objects. So I'm trying to kind of just humanize it a bit as an idea, just to plant a seed with you. And you're welcome to always pick it up with me because I've been trying to help people for about 20 years with this now. And it is really important that we understand that drugs can't be, we're using all these euphemisms, and we wouldn't tolerate it with any other kind of identity or, prescribed speech, hate speech and things like that. We always protect people, and yet we're talking about a war on drugs as if it was like an atom bomb was a war on bricks, concrete, and we're talking about these mythical categories of drugs that don't exist. So drugs cannot be regulated, illegal, illicit. Only humans can be. And if we put ourselves back in the equation, it takes a lot of reprogramming, a lot of realignment to achieve this, because the memes run so deep in us that we've been programmed. But we're using the language of prohibition, whether we realize it or not. And it is very stigmatizing to talk about illegal drugs because they don't exist. And that idea cuts us out of the equation. It cuts us out that all those possibilities of regulation that we want, those licenses, prescriptions, authorizations, and exemptions that we want. And those only will come into view when we rehumanize the discussion. And I'm sorry to kind of put it as a pitch rather than a question, but I couldn't resist because I just felt it was so important listening to that last talk and other talks that they're so brilliantly conceived and so much effort, but yet they are just missing the mark because, in my view, because of that idea that we're using the prohibitionist given narrative without realizing the harm that it does, because it's a figure of speech. And when you cut yourself out of the equation, so a drug which is illegal to possess without a license, exemption, or authorization, when that becomes an illegal drug in our minds, that's an indivisible stigmatizing kind of absolutist idea, and it's not even right. It's not right biologically, linguistically, or legally. So I'll leave it there because I realize I've kind of doorstepped that. But thank you
No,
very
no.
much.
I
Thank you
think you
very
make a
much.
great point. No, thank you. And I'm really happy to touch base after this call too. But I would say one of the main things that we do at SSDP is focus on that person-centered language. So our slogan is "The war on drugs is a war on us," and then we also one of our other slogans is "Legalize people who use drugs." So this is much less about the drugs themselves and, of course, the people who use them, because those are the ones that are being affected and those are the ones that are being locked up. It's not the drugs that are being locked up. And so, um, as I mentioned, I always advocate for people being able to share their stories because I think that's how we humanize this conversation. So I think what you're saying, Daryl, is completely spot on. So I appreciate you raising awareness to that because this is less a legal issue about where drugs fall and more like how are we actually regulating the behaviors and actions of people.
Thank you very much.
Yeah. Thank you.
We also have some questions from the Q&A. So um, we have yeah, it's Joel, I think, or Joel. Thank you for sharing, Gina. I'm wondering if you see harm reduction for drugs other than psychedelics related to the psychedelic policy itself. How can one inform the others?
Hey, Joelle. That's a good question. So I'm wondering if you see harm reduction for drugs other than psychedelics related to psychedelic policy itself. I'm not sure if I'm going to answer this incorrectly. I think it's interesting. Generally, when we focus more on our harm reduction policies, it is related to like opioid use. So there is a really strong, I think, conversation around harm reduction for psychedelics. I don't think it's actually really been properly implemented in a lot of our policies, unfortunately. And I think I kind of glossed over this before, but I feel like that's why a lot of our decrim policies fail is this lack of a harm reduction in inclusion language in the bill. And so in most of our experience talking to legislators, I would say always their first question about psychedelics are like, is this safe? And so I think that notion of harm reduction should always be completely essential to this conversation. And I mean, in general, a lot of us know the safety profile of psychedelics, but there's always so many other things that are being considered, like are kids going to take psychedelics or are people going to take psychedelics and drive? And so I would like to see that be more of a conversation around not just for psychedelics, but like drug use in general should have a harm reduction centered narrative to it. And I think that that is changing, which is positive. But thank you for the question. Oh, I can see them too, but I see this pharmacist question.
Yes,
Good
yeah,
question.
this was about to jump to. Yeah.
There is, I'm going to butcher the name. There is a psychedelic pharmacists association. I don't know if that's the exact name of it, but if you look up psychedelic pharmacists, there is a group of people. And I think you can be able to join through their website online, but there are pharmacists that are specifically working on this and in the advocacy field. So yes.
Oh,
Oh,
and there's also another one from, yeah.
should I go Joelle?
Yep. Mm-hmm. I can read it. Another question I have is how does your background in communications inform the way you articulate this information for lawmakers and to the public?
That's a great question. So that was a really big goal of my master's thesis, which was to see how psychedelics are being talked about, but also specifically like what narratives are actually helpful for moving this forward. And so I think in the places that it's been the most successful is when we're not talking about this at all. This is like not a political issue. It shouldn't, well, it is, but it shouldn't be a political issue. And I think that if you can like eliminate that like political language and those political barriers. Like we're not pinning people against each other or trying to leverage a policy over another. Really, at the end of the day, is that we're just trying to help people, families, and communities. And it's kind of hard to argue with that narrative. And so I would say all or most of us, whether it's us or someone that we know, have experience with someone with whether it's a mental health issue, chronic pain, things like that. And so when we're presenting that this is a real legitimate option for people to heal and have a better chance at having a fulfilling life, I think that that is incredibly persuasive. You're probably also familiar with um, there's I think so many groups that can benefit from psychedelics, and I'm not saying that they're for everyone at all, but of course we've seen that working with populations like first responders and veterans has had a lot of sway with lawmakers. A lot of them are veterans themselves. So I think that if you can speak to legislators and their direct experience is really persuasive, but also just showing them that even hypothetically, the toughest people in our world, like special operations veterans, are still coming home and they're struggling and they're benefiting from psychedelics. It's hard to deny the fact that, yeah, even our people that we would assume don't need help also do, and they're seeing that.
And we also have a last one. That's a long one from Steve. This might be a bit too niche of a question, but I had a thought during a talk. If when MDMA gets FDA approval and possibly is rescheduled, what happens to all the analogs that will be scheduled based on their ability to substitute for MDMA? Is there any effort to prepare a case for the rescheduling of MDMA analogs? And that's our last question.
That's a really good question. That actually is really relevant. I don't think that's too niche at all because this also applies to psilocybin. So, for example, I'll get to the question, but Compass Pathways is also trying to pass legislation for their like synthetic version of psilocybin. So we're seeing that take place on the state level, but also if MDMA gets FDA approved, it is Lykos's version of MDMA. I think it's called mitophetamine. And so that actually would approve mitophetamine and not all MDMA analogs. And so I'm actually not familiar if there are other scheduling cases happening right now or rescheduling MDMA analogs. I think that might be more suitable on the state level. So if you have a bill that says if MDMA or mitophetamine gets rescheduled, you're also including analogs of MDMA. So I believe, for example, for the Texas Ibogaine bill, they included Ibogaine, but also, to my knowledge, like analogs of Ibogaine. So I think if you're like working on any policies or advocating for them, just like specifying that language in there is really important. But thank you for the question.
Thank you so much, Gina. Thank you so much.
Thank you all. Um, just to put it lastly, I have my info on this last slide. So if you have any questions, there we go. But I have my email here. So it'd be awesome to connect with some of you offline and answer any other questions I didn't address. But it would be great to learn more about what you're all specifically interested in and how we might be able to support you in that process. And it's been awesome being here. And so I really appreciate the opportunity and thank you all for putting this on.
So much, Gina, for being here and sharing your knowledge.
Thank you all. Take care.